Hello, everyone. My name is Linda Uboti. The therapeutic intervention exercise that I'm going to be discussing and also demonstrating today is called a deep breathing exercise. This is an exercise that is normally used with people who are experiencing stress, anxiety, panic attacks, going through the breathing process, post-traumatic stress disorder, professionals in need of self-care from a stressful day, family and parents, especially those parents who are easily dysregulated by their children's behavior. Um, this exercise has been around for a while. I find as a crisis worker that I use this a lot with the patients that I meet in the ER as I meet them at their worst moment in their lives at times, and also with their family members who are struggling to come to grips with what's going on with their daughter, sister, mother, husband, and is just looking for a way to cope. So I sometimes have to use this to help the patient or their family member center themselves and relax so we can be able to do an assessment. Um, it's always helpful to have positive thoughts, positive thinking, to have affirmations, little notes I sometimes collect. This is one of my favorite ones. Give yourself permission to take time to breathe because that's very important to life, and to also love and reflect. And being present is very helpful in what we do. Uh, Deep breathing, the air from uh, the yoga standpoint is one of the fourth element of our body and is very essential to the way we live and how we live. It is very helpful if you're able to take in a good amount of oxygen and let it out when you're experiencing stress or you're having flashbacks or having traumatic experiences. It helps you relax, it helps you calm, it helps you uh, are able to form logical thoughts when you're making decisions. In order to do this exercise, you have to be able to focus. So if you're doing it with someone, you have to be in front of them. You have to be calm. Your voice has to be soothing. You have to talk in a slow, soft voice and have them, whether they're comfortable, closing their eyes, keeping their eyes open. It's up to them. You're going to start by having them sit up, sit on the floor, wherever they feel comfortable. They're going to have to sit up with their shoulders up, uh, head up, so they're opening their diaphragm to be able to receive the oxygen and to also let it out, and just to be able to breathe. That's the goal. You want to talk them through it or talk yourself through it. Just calmly start to ask them to relax themselves, relax them shoulders, sit up, hold your chest up. Uh, Side note, you want to make sure that they're not constricting their chest as they're breathing, as that's a trauma response. That's when your body knows that you're about to be traumatized, or that's the fight or flight response. So you want to be very careful that they're open and they're relaxed, not tense and uptight, because once they do that, they're not going to be able to accomplish the breathing. So here we go. We're going to start this exercise. I have my coworker. Her name is Ebony. She's going to be helping me demonstrate the deep breathing exercise. So I'm going to bring Ebony in now, and she's going to come in on the video, and we're going to start. I'm going to pull out because they said there's only space for one person on my webcam. So Ebony's going to take the chair, and we're going to start the process of the video. So here is Miss Ebony. This is my coworker. Ebony, say hi.
Hello.
All right, so I'm going to walk Ebony through the deep breathing exercise, um, and we're going to talk about it after we're done. So as you see on the diagram, we have the picture of your airway, your lungs, your stomach. You want to make sure that you sit up. So I'm going to ask Ebony to sit up, make sure she is relaxed with her shoulders. She can place her hand wherever she chooses. Some people will place their hands on their stomach, on their leg, as long as she's relaxed and feel comfortable. So Ebony, what we're going to do is we're going to do a breathing exercise that will help you relax, regroup, and think about what's going on in order for you to be able to make a logical decision or just to relax after a stressful day. So I'm going to ask you to sit up. I'm going to ask you to be aware of your surroundings. I'm going to ask you to sit back in the chair if you want, or you can sit up. It's up to you. And we'll start the process of the deep breathing exercise. So we're going to practice. We're going to practice breathing. So I want you to take some air through your nostrils. Let it into your stomach. We're going for your belly, your gut, bottom of your stomach. We're going to let the air in. We're going to hold it for a little bit, and then we're going to let it out. We're going to do this at least 10 times, and then we're going to repeat the process if we need to. So we can count in as the air goes in, and we can count out as the air come out, just so we can track what we're doing. So I'm going to count to 3, and then we can start the exercise. 1, 2, 3. So I want you to take air in through your nostrils, and then let it out. I want you to notice as the air goes in through your nostrils, feel your surrounding, feel your stomach where the air is going. Relax yourself and make sure your chest is not constricting, because that's not going to help you. What's going to help is taking that deep breath through your nose and your mouth, and then letting it out. So we're going to count 1, we take it in, and then 2, we let it out. Just have to remember everything's going to be okay. It's 2, and then we'll do 3. We need to have those positive thoughts as we go along. If you find your mind wandering, that's okay. Just want you to think about something pleasant, like a favorite smell of yours, a favorite person, a favorite place that you've been, a safe place, something that makes you smile as you're breathing. You can also relate this to colors, colors that make you happy, colors that takes away stress. Some people think about blue or green, yellow or pink as you do this. And so this will be number 4. Let it in and out. And we're going to do that again. We're on number 6. In, and then we'll let it out. And then we're going to breathe again and let it out. As we continue to do this, you'll notice that you start to become calmer, more relaxed. You're able to feel your surrounding. You're able to feel your world. You're able to center yourself. So you continue to do this, and as we get to number 10, then we can either, if you're comfortable, count down from 10 to 1. So as we're at 10 now, we're going to start the process of counting down. So we're going to count from 10. We'll let it out. 9. We'll let it in. Deep breath. Feel your stomach. Feel your muscles. And then we'll let it out. And then number 8. Go in through your nose, let it out. Number 7, take it in through your nose and your mouth. Now you want to make sure you open your mouth to a point where all the air from the bottom of your stomach comes out without constricting your chest, because that's very important. As you continue to do that, number 6, and we let it out. And then we go with number 5. We let that out. Number 4. Let that out. And then we go with number 3. Let it out. And we go with 2. And we let that out also. And number 1. And we let it out. And I just want you to feel your surroundings. How does it feel? How are you feeling?
I feel calm.
You feel calm? Did it help at all? Did it help you relax? Were you able to focus or concentrate?
Yeah, I was very focused on my breathing by holding my stomach. That seems to work better because you can actually regulate your breathing and you can actually feel in the air coming in and coming out once you hold on to your stomach.
Is it hard to stay focused as you do the deep breathing exercise?
Sometimes, but not a lot. Sometimes, but I find that holding my stomach made me focus more on.
So it made you aware, being present in the moment as to what you're doing.
I felt more grounded once I, hold my stomach. I was able to focus more on the breathing.
All right, so I'm going to say thanks to Miss Ebony for helping me demonstrate this therapeutic exercise. Thank you. So that's the therapeutic exercise that I chose, deep breathing. You can see that I got my information from goodtherapy.org. They have a lot of good resources on that website. And the pictures that you saw in my intervention, I got them from Pinterest. And also wikihow.com shed some really good light. They had on the deep breathing exercise, the various deep breathing exercise things you can do to accomplish your goal of trying to relax yourself. I find this exercise to be very helpful. As I said, I work in crisis at Abington Hospital, and we have a very busy ER. So at times it can be very chaotic. So having the client to be able to focus and to be able to be present in the assessment can be difficult depending on what they're going through. And also they come in with their family, their parents, and that can be really chaotic and difficult also. So I want to say thanks for allowing me to demonstrate this exercise. And please leave me feedback so I can know whether this was helpful or not. Thank you very much. And I'm going to sign out now.